In the recovery room today, we are talking about the human cervix. Why? Well, because nearly half of the Earth's inhabitants have one, and the cervix, like most body parts, is susceptible to cancer. I'm physical therapy specialist, Dr. Leslie Waltke, and the color of the recovery room spotlight in this episode is teal, and we are talking about cervical cancer. Let's begin by showing you where the cervix is. The cervix is the lower portion of the uterus where the uterus attaches to the upper vagina. Now on to the stats. Cervical cancer is the fourth most common type of cancer in women. In the United States, annually about 13,000 women are diagnosed with cervical cancer, and about 4,000 will lose their lives to it. Worldwide, each year, there are about 570,000 new cases of cervical cancer diagnosed and nearly 270,000 cervical cancer deaths. Upwards of 90% of these deaths happen in low and middle income countries where women have no or limited access to health care. In high income countries, with vaccination and screening, most cervical cancer is preventable. Cervical cancer prevention is twofold. First, about 90% of cervical cancers are caused by the human papillomavirus, or HPV. There are now HPV vaccines available for our children. Secondly, since early cervical cancer has no symptoms, screening is critically important. Most cervical cancers happen slowly over time and start with detectable precancerous cell changes called dysplasia. They can be found on screening. If found, this dysplasia can be treated or removed, effectively eliminating the development of cancer. Over the last decades in high-income countries, screening has decreased the incidence of cervical cancer by 70%. But even in high-income countries, prevention requires two things. Number one, as we discussed, is access to health care. And number two, and just as important, if you live in a part of the world that has health care and has cervical cancer screening, we still need to be comfortable talking with our doctor or nurse about our sexual and reproductive health. Unused education and screening programs are of no value. We all have body parts, some of them internal, some of them external. Some of them associated with the circulatory system, some with the nervous system, some with the respiratory system, and some with the reproductive system. It is silly to put our lives at risk because we are uncomfortable saying words like vagina, cervix, uterus, fallopian tube, ovaries, penis, testicle, or prostate out loud. In the 1940s, 50s, and 60s, women suffered needlessly because no one dared say breast cancer out loud. Look how the times have changed. Let's keep changing the times. January is National Cervical Cancer Awareness Month, and the cervical cancer ribbon is teal and white. Talk with your primary doctor or nurse today to discuss how best to protect you and your health. I'm Dr. Leslie Waltke signing out from the recovery room. Let's talk again soon.